Hi, I'm Dr. Felix Cohen from Cohen Medical Practice. Today we are at one of our surgical centers here at Gramercy Surgery, and we wanted to show you around, and so that way when you come here for your surgical experience that it's not an unknown situation. So come take a look with me and feel free to ask any questions along the way. Just giving you an idea about what happens behind the scenes of the surgical process. From the moment that you and your doctor have made a decision that surgery is the next best route, our surgical team comes together to schedule you and prepare you for surgery. That comes with choosing the best and safest location for the surgery, as well as the best day and time for the surgery to take place. We gather our team, we make sure that you're medically optimized for the procedure, as well as we check out all financial responsibilities that you might have for the procedure. You'll have direct contact to our surgical coordinator throughout the process, as well as our surgical team within the surgical centers and the hospital that will guide you through the process. The most important recommendation I have for you is make sure that you ask all of the questions that come to mind directly to your doctor and your surgical care team. We are more than happy to answer all of your questions. I wanted to talk about some preoperative instructions that you should adhere to. The most important time is that day before your surgery. It's important to keep a light diet. I usually recommend a liquid diet, smoothies, soup, that day before, just to keep it as light as possible. It is important to remember that after 11 p.m., no food, no water. Just take your essential medications after discussion with your doctor that it's okay to do that for your surgery. But it's important that you come to the operating room without having anything to eat or drink for at least 8 hours. If you don't, that does increase your risk of injuries happening during the time of your surgery, and we definitely want to avoid that. When you come to the surgical center, make sure you give plenty of time ahead of your surgical time to arrive and be present so that the nursing staff and anesthesia staff can do their intake and ask you all the proper questions, and you should also take that opportunity to ask your questions. Afterwards, you'll meet with your doctor who will go over the procedure with you, and that will be your opportunity to ask any final questions, and then they'll guide you into the operating room to do your procedure. Make sure that you also have an escort available to take you home later that day, and the nursing staff will definitely arrange for your escort to be notified at the end of the procedure so that you have a safe way back home. I wanted to give you a glimpse into the operating room experience. Usually when patients have never been into an operating room, that whole idea is a bit taboo. This is our operating room suite. Sometimes when you walk in, it can seem a little bit overwhelming, but just understand that everybody here is here to take care of you. Everything in the room is to keep you safe and comfortable throughout the surgery. But don't worry. Come in with a positive mind, take a deep breath. The anesthesiologist and nursing staff will welcome you. Your surgeon will be by your side and helping you get comfortable before you're put to sleep.
So when talking about postoperative pain and discussion of care postoperatively, whenever you are in the postoperative room after you are done with your surgery, anesthesia will take care of your needs and make sure that you're comfortable before you leave. For a lot of the surgeries that we do, just Motrin or ibuprofen and Tylenol should be fine afterwards, and we can send prescription strength ibuprofen to your pharmacy afterwards. For some surgeries, depending on what they are, things like Percocet or some stronger medications are sometimes needed, which we can also send to your pharmacy. Your pain control and comfort is our #1 priority, so you should always be able to reach out to our office before or after your procedure if you have any questions or concerns.